Hi to everyone who's just joining us today for another Totara community webinar. We're really happy to have everyone here. Please feel free to tell us where you're coming from in the world. It's always great to see people coming from all over the world and lots of different countries. And also let us know your role, which industry you're coming from. If you're coming from the UK, from the NHS, for example, let us know in the chat. As we go today, feel free to ask questions. And today we're super lucky because we are joined by the team behind an incredible platform from the Emirates Health Service. So just as a starting point, I'm just going to go around the webinar to ask us, the speakers today, just to introduce themselves. So if I start with Dr. Mohammed, would you mind introducing yourself?
Yes, hi Matt, hi everybody. My name is Mohammed Nassif. Basically, I'm an emergency physician by background, board certified, also with a background in medical education and management. And I'm working now with the Emirates Health Services in their e-learning and simulation programs.
Brilliant. Thanks so much, Mohammed. And Mohammed Hamid, would you mind introducing yourself?
Hello, everyone. So my name is Mohammed Hamad. I'm training and development expert at Emirates Health Services. So my background is a little bit more of a technological background. I have a Bachelor of Computer Science and been working as a solution architect and solution engineer and product manager as well. Yeah.
Brilliant. Thank you very much. And Somaroy, would you like to introduce yourself?
Yes, my name is Somaroy. I'm the founder member and general manager of Human Logic. And Human Logic has been a proud Totara partner for quite some time now.
Brilliant. Thanks very much, Somaroy. And really great to have you all here today. Thank you so much for taking the time in your evening to come and speak to the Totara community. So I'm just going to go through a couple of our slides to start off the webinar today. So just a little bit of housekeeping about the webinar. So this session is being recorded. So if you do have to drop off, you can come back and watch the webinar recording later. The webinar recording will be available in the Totara community, and you can continue the conversation in the community. So if you have questions today about this webinar or what you've seen, feel free to come back to the community and ask some questions, and we'll come back to you and help to answer those questions. You're also very welcome. You're also very welcome to ask questions in this webinar. So please use the chat or the Q&A button, and you can ask questions as we go. If the question is relevant to the section, I'll try and answer that with the speakers today at the time. But if it's not relevant to that section, we'll just answer the question at the end. But feel free to get involved as we go through today's session. If you're watching this recording on YouTube, for example, you can come and join the Totara community. It's a free community to join. It's full of like-minded professionals, such as the team here today, and also thousands of other people all over the world trying to do different things with their Totara platforms. So I think Dr. Mohammed, would you mind giving us a sort of brief introduction to the Emirates Health Service and what you do and sort of your mission?
Sure. Emirates Health Service, or till a few years ago, we were part of Ministry of Health and Prevention. We're basically one of the largest healthcare providers in the United Arab Emirates. Most of our scope is in the Northern and Eastern Emirates. We have a workforce of around 11,000 plus staff and a number of affiliate and outsourced services also integrated with us. We cover around 17 hospitals and 17 hospitals, around 70 clinics, a number of specialty centers, dental, rehabilitation, and similar. Basically, in terms of, as you can see, our core values are definitely the customer first. Innovation is core to our activities. Empathy, safety, evidence-based approach has been very important also for us, and sustainability. One of the challenges we had over the years with training and learning and development and training has been how to reconcile the requirements of your highly specialized staff with the general requirements of the organization. It's quite a diverse organization, both in geography. We cover a very wide geographical area. And also in terms of different services that we provide, essentially the spectrum of services for healthcare, from primary going all the way to tertiary care. So it's a bit like, training a dragon. How do you train the different heads of that dragon so that the whole dragon moves together in the same direction? same vision, same standards. So you get the same care, whichever hospital you go to or whichever clinic you go to. It's essentially the same service and the same quality. I'm sure this is not unique to us. Working in different healthcare systems in the past, everybody suffers from this. But I think we just had to keep on using innovation to find a way. And I think working with Totara and our dear partners in Human Logic in the UAE, I think we started to find the right solution to move in the right direction to make that happen. So essentially, our solution, if we give it a word, it's personalized learning using AI and competency frameworks. All things that Totara either provides out of the box or with some customizations and additional modules with Human Logic.
Brilliant. Thanks very much for that. And today we're going to have a demo of the platform in a minute or two. But first, if we just think about, you've sort of said there roughly why you chose Totara, but also why did you choose to partner with Human Logic?
Various reasons. I think Human Logic are very well established in the United Arab Emirates learning and development and e-learning market. They have an impeccable reputation. I've met with them and worked with them in different, both myself, Hamad, and many of our colleagues who are in the e-learning community have interacted with them in the past. And throughout, not because Samaroy is here, but throughout, we've had a very positive experience. And they just made the natural partner to work with to make this happen. Totara gives us a very nice DNA of the learning community. Everybody's learning is in the code of Totara. And whatever additional customization that our particular situation, particular institution requires, Human Logic were more than capable of supporting us through that.
Brilliant. Thanks very much for that. And Samory, if we ask for a brief introduction to Human Logic and what you do.
So yeah, just to give an introduction to Human Logic. Human Logic is 20 this year, and our primary focus always has been around e-learning and learning and development. And the initial years of Human Logic were predominantly spent around higher education and focusing on how to build learning and e-learning culture in the higher education sector. Where with the advent of Totara in 2012, we started off being associated with Totara and started offering corporate learning as well to various organizations. And one of the first organizations who worked with us has been Emirates Health Services. Of course, prior to this, they were called the Ministry of Health, of course. And we have started with them on Totara version 2.7, which is quite old, as old as not many of us would know, unless you have been with Totara for long enough. So, and we've built a number of things around that to make this customer, not only this customer, but a number of others who are within the UAE and in the Middle Eastern region, to put the focus around e-learning in the corporate sector as well. And as Human Logic, we also develop a lot of content that goes along onto these platforms, and we support most of our customers around with the content as well. I think you can just move just to give you a portfolio of what we do. We do a lot of everything around e-learning. So one of our core products in higher education is the student information system. Apart from that, on the corporate learning, we do customized content. We do a lot of digital learning mobile apps. When I say mobile app, it doesn't essentially have to be a specific mobile app out of the box that we use now, because a lot of organizations, they see mobile app as a very, very personalized experience that they want for their staff, and also most of the times they would also want it to be a part of their existing infrastructure and offered through other services, employee services, plus e-learning, plus LMS. So we do a lot of these custom developments in terms of the platform, in terms of the mobile app, and specialized applications like simple training apps for blue collar workers, so on and so forth, have been our expertise. Apart from these, we offer all the services around Totara in the sense that, the case in point being Emirates Health Services, they use all the three: Totara, Learn, Engage, and Perform, and using the competencies based learning, as Dr. Nassef was mentioning a while ago, plus the various customizations. And we also offer all the other services like localization, implementation, so on and so forth. So it's like we provide everything that you need as a corporate learning platform or a public training platform that you would require. Then in specific, before we have the wonderful demo by our colleague from Emirates Health Services, I think we just wanted to give you what did we add on to Totara to bring it to something that's more Totara plus, where it actually contributed to Emirates Health Services success was, there's we all know that Totara offers learning plans, but then you also needed they needed to have something which is called personal development plans, or they call it individual development plans, where you want to have a recommendation, approval, and then get on into the course. So it's not only about you picking your courses, but also in terms of how you actually recommend or get assigned from your the management or your organization, where they understand that, okay, this is the gap and this is how you need to go about it. Then CPD points, the continuing professional development CPD, which is basically essential to the sector that they're working in, and most of the sectors nowadays in the corporate training, we all look at how many CPD points that you have done, or how many trainings you have taken, and what you have achieved, so on and so forth. So we had to develop a personalized module where each course, or it could even be a seminar, webinar that they attend, and then it contributes to their continuous learning and professional development, and then it comes to a place where they collect a certain learning or knowledge and skills during the year. Then also about something which is unique in nature. We all know about ROPL, which is basically the recognition of prior learning, but then Emirates Health Services in specific required something where the users take the courses from external entities, or probably by attending certain specific conferences, seminars, so on and so forth, and then they come back and then give these certificates for evaluation, and then they contribute to their overall learning and performance. Then the sheer size of Emirates Health Services required them to hear what people are looking for. So they wanted to have ears where they want to understand what are the courses that people, doctors or medical staff, or some of them require in terms of improving their knowledge and skills. So there's something called course request manager, where they could request for courses, and then the organization looks at the feasibility of providing them either internally or externally, or even recommend certain courses and then get them evaluated as well. Then we also improved a lot upon the Totara recommendation engine, which actually is a part of Totara Engage. But then we also had to do a lot of improvements into which are more specific to fit the requirements of the organization, where they had to include recommendations based on certain trending courses, tenant-based courses, which basically they run a multi-tenanted environment, where they have Ministry of Health as a specific tenant, EHS, which is the services, Emirates Health Services is a different department. So all of them, they would have specific recommendations and specific ML learning has been introduced into recommending certain recommendations for them. So it's more around what do you get Totara plus. And One of the things where we chose Totara, and we've been very happy with the decision, both us and the organization Emirates Health Services, has been that this constant improvement. There's a lot that has evolved. Looking at where we started 5 years back with Emirates Health Services, now we're very happy that we implemented multi-tenancy starting last year, and which essentially means that they have a couple of tenants where each of them they authenticate through different Active Directories, have a completely different look and feel, have a completely different set of courses, recommendations, and also in terms of the look and feel, of course. Then they also implemented a part of the Engage Total Workspaces, where they have department-based and audience-based groups, and then they share a number of libraries, news articles, journals, and basically to bring up social learning and community-based learning, and it's learning is a part of the organizational culture to bring about the experience and the change that they would request. So it's been quite a good experience in terms of how Totara has evolved and has helped to achieve what's been on the plan, let's say. So I guess we can move ahead.
Brilliant. Thanks very much for that, Somoroy, that great introduction to human logic. So I think Dr. Kalthoum has also joined us. I don't know if you can unmute yourself, Doctor.
Yes, good evening, everyone. Actually, sorry to join you a bit late. There was a bit of technical issues. But I think Dr. Nassif, he presented well about EHS as an organization, but if I'll take you to the same discussion, which was about Totara and Maharati as a system which is built through Totara system, how it is evolved, how it is improved, and where we are taking it, let's say, from only the static training and development or employee development system toward the AI directed, and how it is personalized per employees. And actually there is a lot is coming on and expectation from our strategic partner in order to develop the system so it will be friendly enough for the employee, let's say, build in order to develop more using new AI tools. This is actually what we are looking for. The development which was for Maharati, as we call it, as a system, it was well recognized through employees, through let's say leadership in EHS, and from other institutes which they are usually visiting and looking us in order to know more how we are progressing with the system. This will not happen unless we have talented employees who's running or managing the system with our friendly system, flexible enough in order to build on it. So this is in brief, and whenever, let's say, there is any input from my side, I'll just give it through the discussion of this webinar. Thank you.
Brilliant. Thanks so much, Dr. Kalthoum. You feel free to put your camera on as well next time if you feel comfortable. Okay, so just moving on to the next section. So really underlying the principles of the platform, you have two sort of main threads. If we jump into those. So
yes. And if you want me to give an input here, actually, through how we build it, Maharati, or let's say the system which was there, it was only concentrated on the training as let's say a platform for training. We merged the knowledge repository, so it will be enriched. The training by itself as a courses, the dynamic training is there. And e-learning, of course, this is one of our EHS vision, and the system is helping us for that. We also added a knowledge repository, so all the resources as a knowledge for all the employees will be available in Maharati, together, of course, with the e-library. So it is the system which is combined the training, the knowledge management system, and the e-library. So all the resources for which is required by or needed by the employee will be available in this Maharati platform.
Brilliant, thank you. And Dr. Mohammed Nasser, would you like to add anything about knowledge repositories here as well?
Yes, exactly. I mean, like Dr. Kalthoum said, one of really COVID-19 kind of brought this to the forefront for us. There was a lot of information happening very fast, changes in guidelines happening, and people were not just keeping up with the latest, best way of doing things. Plus, as you might remember, there were a lot of rumors, inaccurate information circulating around. And that sparked the very first knowledge repository we had on COVID, where we collected information, national, regional guidelines, international guidelines, latest courses, including things related to mental health and coping with stress between colleagues, ourselves, and with the patients. And all this information was collected so people have easy access to the latest, not to some version of information in one place. And like Dr. Kalthoum said, it just picked up. It became a movement. People found it very useful. Then we had an interest coming from the hospitals department. Then we had nursing department, mental health, and then it's just now it's a way of life for us. When the monkeypox happened several months ago last year, it was a natural thing that we create a repository for it. Luckily, it didn't need to be as extensive as the COVID-19 repository, but it is definitely a very useful approach of collecting information for us. You see,
Yes.
in EHS, our knowledge management strategy is we have a huge number of very highly qualified staff. So there is a lot of knowledge in people's heads already. It's a matter of how do you make sure that's kind of documented so it's easily shared between the different facilities and hospitals. And Totara has been extremely useful in helping us to do that. Converting material into different readable e-courses, audio, video material, and sharing it. And once we had a large collection, we started to put it together under certain headings.
Brilliant. Yeah, I imagine COVID-19, one of the times where you had to get a lot of information out very quickly. And it's great to see this knowledge repositories coming together, and also, like you say, for monkeypox and many other issues here. So you also, the other driver is really to develop a sort of personalized learning platform as well. Or was there more you wanted to say on this section here about competency profiles and achievement paths as well?
Yes, definitely. Dr. Kalthoum, would you like to talk about that?
Yes, I'll start, then you can continue, Dr. Nassif. Actually, what we were thinking when we just develop a personalized talent development, we call it, to build the system to combine both the competency required by the organization by itself as a department, as a line manager, and the behavioral competencies which is required also from a federal entity. We have it FAHR, which is the Federal Human Resources Authority. So just to put it together in order, whenever the recommendation come by the system, that these are the required training courses based on these competencies. So we covered required competencies by the organization based on the strategic direction, based on their strategy, based on, let's say, what are the emerging new training required or skills to be developed. And we also put the employee as a requirement, which is the soft skills, communication skills, or even leadership skills, business skills, and all of these on behavioral competencies to be fulfilled. So according to the it is actually two ways. One, through the historical information which is available in the system. So the recommendation will come per employee based on their historical training record, which is within the Maharati, and also now developing it toward a competency which is required by the line manager. So this is actually in brief. So Dr. Mohammed, if you want to add, and it is employee specific. So here we are reaching toward a concept of the personalized talent development. So it is unique per employee. Dr. Mohammed?
Thank you, Dr. Khatib. Matt, if you look at on the picture on the screenshot on the right, Totara gave us the flexibility to put the structure and the assessment method that we feel most suitable for our needs. So since we are a healthcare community, we borrowed from the Miller's triangle of assessment, and we kind of modified that to fit our needs in assessing people's competency. So you can see there's knows how, shows, and does. And because we have a knowledge management strategy that's core to how we are doing our learning and development function, we made our own modification on sharing knowledge. So for us, ultimately, it's not just doing good care, but if you share how to do good care, whether you are providing training, writing policy, or providing supervision, reviews, and similar, then that would be fulfilling our structure. And Totara was flexible enough to allow us to install that structure that we feel most appropriate. And like Dr. Khatib alluded to, we also have behavioral competencies that are very much coming to us from our parent organization, since we are a federal entity. So we also have certain behavioral competencies that are coming from the Federal Authority of Human Resources. And Totara again gave us the flexibility to be able to put those as they are and be able to implement them and connect them to the training programs that we have in the system.
Brilliant. Thanks so much for sharing that. And we also have our AI-generated personalized learning recommendations. I'm sure you'd like to touch upon this at all.
Yes, I believe Dr. Khatib mentioned that one while talking in the previous slide. If you could see the slide on the picture on the left, these are screenshots from the user views for two different employees. We took their permission to put that. So you could see they have different recommendations based on their portfolio. So if the portfolio is through a machine learning generated system supported through Human Logic. So it looks at the history of the person, looks at their competencies as well. So we have a recommendation. This one looks like a recommendation based on the history. So it's kind of like a Netflix style. Also, we have another one which implemented after that, and it's all active now with the help of Human Logic on looking at the competencies assigned and recommending training that is related to the competencies and competency gaps the person has. So they wouldn't be lost in the sea of training that's around there. They would have things that are suitable to their interests and their needs, both at the same time.
Yeah, brilliant. Thank you so much for that. Yeah, a lot of the time people can get lost on it. There's always lots of content on a platform. It's great that they have this recommended personalized learning journey through the platform. Okay, what I'm going to do is I'm just going to stop sharing my screen for a second, and Mohammed Hamid is going to take us, I hope, on a specialized demo behind the scenes now. So if you're able to share your screen, Mohammed, there we go. Brilliant, that's working perfectly. Yeah, and so what we're going to do is just sort of take a bit of a learning journey, really, and sort of see what the users see as they go into the system. So here we're starting on the landing page. I don't know if you want to explain a little bit about what's happening with the landing page here.
Yes, definitely. Currently, what you are seeing right now is the landing page of Maharati, as you can see it here. I actually logged in, or maybe have two different browsers, one and both are actually going to the same link, as you can see here. But because the beautiful feature of multi-tenancy that we can see that we have, even the login page has been customized to the different tenants. If I'm logging as it kind of remember my tenant that I have logged in. If I'm from MOHAB, the Ministry of Health and Prevention, then it will remember my theme that I have customized here, or the branding that I'm using. Or if I'm using the EHS user, then I'm logging in through the different team as well. As you can see here, I would be going to log in with a user here in the Ministry of Health. Just a moment. So this is the main landing page of the of the system, and if I'm going, I already logged in here through an EHS user. So as you can see here in the EHS user, it have a different branding, and we kind of actually share some of the courses together between EHS and MOHAB. There is some specialized courses for different entities, but the multi-tenancy enabled us to have a different theme, as you can see, or different branding between each and every one. And we can, at the same time, share different courses or share different features together at the same time. As you can see here in the main page, we included some banners representing different activities that we are having currently in UAE. We have March as the reading month. So we have here a banner that will take us directly to the e-library that we are having, and it have a complete set of different resources that is the user can log into and navigate through and so on, as you can see here. And also in the main page, as you can see here, it will show the different trending courses. And this is automatically updated based on the usage of the complete over 20,000 users is actually running in the system. Maybe more than 11,000 is EHS, and we have also MOHAB employees around almost 1,000 employee, and we have also our different partners or outsourced employees that is actually log into the system and be able to navigate and use the system as well. So it based on that, it's actually recommend or show you the most trending courses. I will navigate to one of the courses just to show you quickly a structure of the course that we are having. So here we have, and by the way, we have our team here, the e-learning team in-house that is actually building those courses, as you can see, and the complete scoring packages and all of that. This is a course overview. What is the learning objective of that course, when it has been released, and when is the last update and review. We have a complete policy on when we are going to review and update each and every course. How many hours this course is giving, like CPD hours or training hours? Is it for healthcare providers? Who are the subject matter experts that is actually participated in building this course? What is their qualification, and so on. And of course, if I would enroll then in that course, then I would see different modules in this course and so on. Okay, I will return back to the main screen here, and I'll show you. So we have here the different trending courses. We have different quick links. We usually run different announcements that can go to the different, to all the users or to specific group if you want. And as we are currently in the reading month, so we have different courses related to the reading month and from our leadership. So we post about those announcements as well to the different teams. On the right side, as you can see here, we have a recommendation engine that is running according to what competencies that this user is having currently. So this competency, it will recommend for me some courses that will help me achieve that competency and so on. At the same time, we have also the recommendation engine here that is actually understanding my behavior on attending the different courses and what are from the experience of learning, what are the different courses I have attended, what is my interests compared to others, and then it will start showing me different recommendations based on that. So if I go to the other user, as you can see here, he is having a different recommendation. It depends on his usage of the system and so on, and then it will kind of understand and learn and try to recommend different courses for him to the system. There is plenty of different, just trying to quickly explain to you the main screen, and then we can dive more into different features. In the left side, we have, for most of the users, the new external certificate request. So people can apply from here for external certificates. And this is one of the customizations that we have shown. It's important for us to recognize and make sure any external training that our employees or have taken outside, they can add it to the system. We can recognize it, whether it's a CPD course or a regular training course. So usually the user can come here and he can select, is it a CPD certificate or training hour certificate, and based on how the delivery method has been done, and is it locally happen or internationally. So he can select and start submitting the request. He can start entering all the details about the training, the number of CPD hours, and the certificate that he had, the agenda of the program, and all the details that is actually required from the CPD committee that will review actually, or the CPD team that's going to review this external certificate and award him the same and authenticate it and accredit it into the system as an external certificate. So just returning back to the home screen. Okay, and also it is the users here can easily navigate. They can see their own CPD hours or training hours, and we made it easier for them to view their training record. So for example, as you can see here, I can view my record of training for 2022, and it's not only as a learner. So here, as I can see as a learner, what courses I have completed and how many number of training hours. We have also the training hours as being a trainer when I was training on those courses, and on which dates and number of training hours provided, and even the external certificates that I have submitted as training hours, and they got accepted or approved into the system from the external certificate training team, and even the training hours being as a speaker in some of the courses as well. So it kind of give me a full report about my training hours, or even I was speaking in a moment also, we can have a complete CPD report as well for the employee, which is required basically for maybe relicensing as per some of the regulations. We have to have specific CPD training hours every year for relicensing and so on. So we can see how many CPD hours that has been taken as well, and what is the accreditation number for that course and so on.
Brilliant. Thanks so much for showing us all of that so far. And obviously one of the things you were showing in the personalization aspect was that your competency and your achievement paths. I don't know if you could quickly show us what that looks like as well.
Yes, sure. So as you can see here, also the competencies, users can come here to develop their competencies into the system. They can see directly, as Dr. Muhammad and Dr. Kalthum was mentioning here, we have the Federal Authority of Human Resources behavioral competencies, which is automatically by the help of the system, we are able to assign those competencies to specific audiences as per their different grades. And so we was able in the system is integrated with the ERP. We are having all the different grades of the employees, and then we are able to create different audience group that actually based on that, it automatically will detect the grade of this person, and then it will assign him the behavioral competencies that is needed for him to complete his work. There is, I will show you some other users in a moment that is actually having directly assigned competencies from their manager, or maybe the user can come here and self-assign a competency. But let me first start showing you one of the competencies here. So the user can see here the different competencies assigned to him in a spider diagram, and he can click on any of these competencies. He can understand a description about it, and even can see the proficiency levels that, or the achievement levels here, and what is the meaning of each achievement level that we are having. And as Dr. Muhammad mentioned, this is based on Miller pyramid, and we have extended it to the sharing knowledge to identify the SMEs in our organization that will help us create that knowledge into our repositories, or even participate in learning or in different articles and journals and so on in those competencies. And I can see here the criteria of the fulfillment for that competency, how I can achieve it. To reach to the know-how, usually you can reach to the know-how by attending a course. So you can define what is the criteria easily in the Totara system, and you can say, okay, I need to have one course out of these two, or maybe I need to have two courses mandatory and another one optional course. And this is typically according to what competency that you are achieving. The user simply can come here and see what are the courses. He can navigate and see all the details about that course, and he can directly come from here, go to the course and start the course and complete it. And once it's completed, it automatically reach him to the proficiency level of know-how. So usually the courses will reach you to the level of know-how. And then after that, using an assessment actually in whether by a manager or even an appraiser like the CRN for nurses, they can actually come here and assess the user, whether it's in the simulation lab that he show me that he do that skill, or maybe he's actually doing that at work, then he can move him to does, or moving him to sharing knowledge while he's participating in the knowledge management. Actually, that would bring me to show you, I don't want to forget to show you the knowledge repositories. I think the team has spoken about it, but let's see it a little bit quickly in action here. So you can see here, this is the knowledge repositories that we are having, and it's keep growing. And you can see here it's different according to different topics or different maybe departments. I will just, for example, the nursing have their own knowledge management, and we have something related for specific diseases like monkeypox, or maybe I would say COVID-19. So this is the COVID-19 knowledge repository, for example, and the person can come here and find all the accurate information about COVID-19, which our team is actually make sure that is updated and relevant and so on. Whether it's coming from World Health Organization, UAE circular and updates, even different training courses that is being provided, that and keep always updating about this subject in our system. And as you can see here, different objects we are having, we can correlate into the knowledge repository.
Brilliant. Thanks so much. That's great. You're doing a great demo at the moment. One thing we're going to look at a little bit was just if you were a manager and you wanted to understand how well your team are performing, you also track that, don't you, in the system?
Yes, definitely. One of the main things that we need to empower the managers to be able to see the different, maybe have a quick dashboard about his team, and that's why we have this feature, My Team, for the user, for the managers. And when the manager is coming here, he can see all the different users that is actually reporting to him. He can see how many courses they have started or completed, how many active competencies they have achieved or not achieved. So it can provide him a complete report about this different users, and he can even drill down into different details like the CPD hours report for that employee, or training hours report for that employee, or even the competency profile of that employee. So this manager, for example, can come to this employee and can see the different competencies assigned to him or to her, and he can see the different where he reached on those behavioral competency. As you can see, it's separated, the directly assigned. Those are directly assigned competencies assigned by the manager, so still is not achieved. And even there is a self-assigned competencies. The user himself, he actually take it for self-learning, so he can assign it to himself. The manager can come from here also to rate a competencies for that employee, or even can assign competencies to him. It's easily for him to come here and assign competencies. He can definitely navigate for, let's say, for information technology. Maybe for this user, I would need to give him a business requirement as an expert. This is, I need him to work toward that competency, and then I can come easily and click assign competency to that user. Also, at the same time, they can come here and rate the competencies of the user. By the way, even if the user has reached to a know-how level in that competency, and I feel that he still needs some training, so I can come here as a manager and rate him that, okay, return him back to a lower level, or maybe bring him up to an upper level. So it's simply, I can come here and select whatever competency that I would like to rate for that employee, and I would select the correct scale that I need for that employee, and I write my comment why I do that, and it will record that into the system, and it's actually showing me the previous rating has been done by the previous manager and when it has been done. So that's also a way for the manager. This is the complete dashboard for him to easily find all the his employees, how they are performing, their CPD hours, their training hours, their evidences, the competency profiles, and even the record of learning that they are booked to take, and so on, and even their profiles and so on.
Brilliant. Thanks so much, Mohammed, for that incredible
Thank
demo.
you.
It's really lucky for us to go behind the scenes and see all of this. So thanks so much for showing us all that. On the system, we've seen a lot of out of the box Totara functionality. But I'm wondering, and Somora, you might want to jump in here as well, just about some of the customized features that you have on the platform, if there's anything you'd like to touch upon there.
Yes, there are a lot of features, as you said, which are very, very Totara specific, and then Totara has helped them in terms of things like competencies or employee engagement, social learning, and also in terms of managerial, ability to assess and so on and so forth. Where Human Logic had to up the game was around a few things like submission of the evidences and understanding the evidences, and customizing the recommendation engine. Also collecting the training hours of the trainers. So usually we understand CPD, we understand training hours, but then the training hours as a trainer and not as a attendee or a learner is something that we had also customized. And then also around the ROPL, where it's a little bit different from how the general ROPL works. So where they had to have an approval process, and then there are a lot of workflow involvements that we had to do around making sure that there is a ROPL workflow and approval. that has been done. So also along with it, one of the other things that we mentioned earlier is around the course request manager, where having a large fraternity who has who probably is very highly skilled in terms of medical industry, you might want to have different courses that are identified, or you identify yourself that probably I need this course, or I need this competency, and then this somehow needs to find its place in Maharati, for example. Then you request for it, and then there's an approval process, and you get what you want. So essentially, it's about building a healthy learning environment is what was required, and then we had to fill in those blocks which were probably missing, or probably very specific to the kind of business and skills development environment that EHS required. So Human Logic has stepped in wherever needed to fill those small pieces and then put it together.
Brilliant. Thanks very much, Somori. And Peter's just asking, is the external certificate a custom app developed by the partner?
Yes, it's more of a you could say it's more of a block or a feature functionality that we developed in terms of as per the requirement. So external certificate requirement, which is unlike the generic ROPL. So where they choose what is the certificate type, CPT certificate or training certificate, delivery mode, so on and so forth, and then they apply for approval. So it's more what you call a custom feature that's been developed by Human Logic.
Brilliant. Thanks for sharing, and thanks for sharing that as well, Mohammed. Just to summarize, really, as we come towards the end of this webinar today, just how the platforms help the organization in general, in a nutshell. If you could summarize that, how has it made a difference to you?
Hi, Matt. I think we've been working with Human Logic for several years with the Maharati system. I think the official launch was 2018, and we have grown with them ever since. In the early days, it was a way to manage the different, mainly face-to-face learning that's happening. But I think with the development of the team in here in Training and Development Center, the support of our technology partner, Human Logic, we started to generate more e-learning content with the local expertise that's available in the organization, plus our partners, plus any visiting consultants. I think you could say this has become, Totara has become, or Maharati, which is my skills in Arabic, has become our external, the organizational brain, where all the information is put together. Hence the repositories came up as an idea. And in terms of monetary value, this has significantly saved us a lot of money. We have actually recently, just a few weeks ago, we celebrated 1 million e-learning contact training hours based on locally created content, in addition to all the face-to-face. And if you look at market value for that, that is in the most conservative kind of estimate, it would be like $5 million or more. So this has definitely been not only useful for us to reach our learning and development needs, develop our staff, but also a way of sustaining learning and development financially and sustaining the knowledge within the organization. So even we've had people who have moved on to other posts and other healthcare systems outside the country or other regions, but their knowledge, the one that they have shared, is still there with us, helping to keep the sustainability of the service and the capability of the other teams to keep the same standard of service as before.
Brilliant. Thanks so much, Dr. Mohammed. So I'm glad to hear you having such brilliant results. And Dr. Kathleen, I don't know if you'd like to add anything to that as well.
Yes, actually, the thing that and the development which was in the system Maharati, it's took it from the static system platform to just only report certificates or the training to the a dynamic with the interactive between the employee, between the line manager and the system by itself, and the team who's managing Maharati as a system in the TDC, or Training and Development Center. So it is much more dynamic, flexible to add on it, and this is actually what is good about Totara, that it is very flexible in adding and developing whatever let's say needs according to the vision of EHS, taking it toward the personalized. So now what we feel that the system by itself, Maharati, as if it is owned by the employee. So there is an very interactive relationship between the employee themselves and the system. So this is actually what we felt when we dealt with the system and with Totara as a strategic partner.
Brilliant. Well, thanks so much for all your inputs there today. And Mohammed Hamid as well, thanks so much for that demo. Yeah, of course you can.
Can I add a word? I think that would be useful for the community. I think Dr. Khathoum joined us. We didn't introduce her well. I think this group, we are together, the panelists, the 5 group, we are quite symbolic of the success factor, a key success factor for this. We have Totara, yourself, you're representing Totara and the technology behind it, the backbone. We have a technology partner helping us to maximize and customize. We have Hamad, who is helping us understand where how far the technology can take us. I'm with the education part, so I drive everybody crazy and trying to understand the healthcare part and how to fit it into the system. But with Dr. Khathoum, she wears 2 hats. She is the Chief Innovation Officer and also the Director of Training and Development. So, and that's really important. If you have a representation, the C-suite for the learning and development function, and somebody who on top also supports innovation, that's a significant acceleration in how things can move. I mean, what we are doing is not magic, but the speed of the development, I think, is because of the 5 people and the teams they represent behind them.
Oh, brilliant. Well, thank you so much for that extra note. That was a great addition to the end. And yeah, just wanted to say thank you very much. It's been an absolute privilege to go behind the scenes of this platform and to understand the successes you're having. And I wish you continued success as you go forward. And I hope that the platform continues to get better and better as you continue to develop it. But it's great to see such potential and such enthusiasm for the product. So thank you so much for your demonstration today. And thank you for laying us into your world as well. It's great to see. And now, if anyone has any final questions, please feel free to come into the community and continue the conversation there. But for now, it's very late. I think for you all now, I think it's definitely time for some dinner. So thank you very much for your time today, and we'll close down the presentation there.
Thank you for you too. Thank you.
Thanks very much. Thanks everyone, and thanks everyone for joining us today. Have a nice evening. Goodbye.